does the procedure work? Typically, the procedure is done under a general anesthetic. It typically takes anywhere between an hour and a half and 2 hours if I'm going to do the entire circumference of the thighs at one time. The reason I'm doing it under a general anesthetic is that I'm working very superficially, and it's very difficult for the patient to stay still, and they feel a lot of pain and discomfort when doing it just under a local anesthetic. I have come up with a surgical protocol which I think gives the best results. I tell my patients that I can achieve anywhere between a 60 and 85% permanent improvement in the appearance of their cellulite. And it depends on the different types of cellulite that the patient has, their age, and quality of the skin. But I've been obtaining very good results. I've performed more Vaser Smooth cases probably than anyone in the world, definitely probably in the United States. I'm one of the authorities on this procedure. But typically, it's a quick procedure. There's not a lot of downtime. Most patients go back to work in anywhere between 3 and 5 days. Patients typically have the procedure on a Thursday and Friday and go back to work on a Monday. There is a little bit of discomfort where you may take some pain pills for anywhere between 2 and 3 days, and then it will be on prescription strength ibuprofen after that. You typically cannot exercise for 2 to 3 weeks following the procedure because I do take some of your fat from another area, and I do layer the fat underneath the skin to try to get the smoothest result as possible and to prevent the cellulitic bands from forming. Because of that, you have to wear a compressive garment which goes from below the knees to above the waist for 4 to 6 weeks following the operation. I do recommend post-operative lymphatic massages and external ultrasound starting after 2 weeks after the fat gets into that period of where the blood supply has grown into it. And I've been achieving excellent results to date.